love music, and we love life. Ayo and Joy are still keeping you company on this journey as we take you home in grand style. And it's time for us to talk about your health because this smooth health on the drive where we talk about health issues and wellness in general, bring awareness and of course information concerning different health issues, different ailments, and of course how one can deal with these situations. We bust myths as well, and of course just give you a general idea of how to live a healthier, more fulfilled life. And today we're going to be having a conversation about breast cancer because the month of October is set aside as Breast Cancer Awareness Month. And of course, breast cancer is an ailment that is actually quite widespread, and a lot of people have heard about breast cancer, about different things about breast cancer, but there are certain things that some people don't know. I mean, for example, breast cancer doesn't affect only men. Even men are susceptible, to
Mhm.
getting breast cancer as well. That is something a lot of people actually aren't aware of, and that's the reason we are here this evening to have this conversation. And joining us to break it all down and give us all the necessary information and everything that it is that we need to know is Dr. Anne Olowu. She's a public health physician, and of course, she is the principal consultant at An Aid Consulting. Very good evening, Dr. Olowu. It's great to have you with us in the studio this evening to have this very conversation.
Thank you. I am happy to be here.
Right. So let's get into the nitty gritty of things. Oh, and for all our listeners out there, if you have any questions for us or any contributions as well, 809 440 981 981, and we're also streaming 91 FM Lagos. You can catch the live stream there. It's very, very important, and I'll be letting you know why that is later on in the show. Okay, Dr. Lu, can you explain the significance of Breast Cancer Awareness Month and why it's very crucial for not just women but men as well to be very well informed?
Well, thank you. Breast Cancer Awareness Month is important because it is the period of the time that we put the spotlight on breast cancer. And why is it important to put a spotlight on breast cancer? Because breast cancer is a global issue. It's an issue, it's an ailment that affects, as you said, both male and female. A
Mm,
lot of people don't know that men can actually get breast cancer. Um, I recall not too long ago when I was talking to a couple of young people and I was asking, do male have breasts? And say, no, males do not have breasts, but really male have breasts,
Mm.
but it just doesn't develop because hormones, I mean, genetically males who are not trying to be politically or socially correct now, males, if you have been assigned to be a male genetically, it is not expected that you would have the female hormones that will make the male breast grow. So men are susceptible. In fact, up to 1% of breast cancers are found in men. And so it's not only an issue for females alone. Added to that, it is a global issue. Breast cancer is the most prevalent cancer worldwide
mm,
in both male and female. When you combine all the cancers in male and females,
Mm.
it is the most prevalent cancer. That's when you take out non-melanoma skin cancers globally.
Okay.
And in Nigeria, it is also the most prevalent um, cancer in both male and female combined when you talk about the cancers
mm.
in in Nigeria. Another thing is in Nigeria, it is the number one cause of cancer deaths.
Mm.
Yes, both in females and males. When you combine all the cancers together,
Okay.
breast cancer is the most common cause of cancer deaths
Mm.
in male and female. So it is important that we this awareness is done so that people can know how to detect breast cancer, because knowing how to detect breast cancer gives the individual the best chance at survival. So it is preventable to a large extent
Okay.
because if it is found early, then it can be dealt with early. And so it's important that both male and female know about breast cancer.
All right, that's important, and I like that. But what are the misconceptions that actually come up when we talk about breast cancer?
Okay, so the first one, as we discussed, that is only females who can, have breast cancer. We know that
Mhm.
that is not so. Um, Another misconception is that women who have bigger boobs are the ones who are more likely to have breast cancer. That is also
Hmm.
a misconception, because whether you have big boobs or you have small boobs, um, anyone is liable to having breast cancer. The difference between people who have big boobs, women who have big boobs, and women who don't have as big a boobs, or as big as who don't have bigger boobs in comparison to others, is the fatty deposition
Okay.
in the
Okay.
breast. Another misconception is they say that the use of antiperspirants or deodorants,
Mm.
yeah, can cause breast cancer. It's research has debunked that myth that
Okay.
um, it has nothing, to do with predisposing people to breast cancer. And not there's so many myths around breast, because I could go on. Another myth around breast cancer is the fact some people say that when there is only breast cancer, only women who have a family history of breast cancer, ovarian cancer in their family, those are the only group of women who come down with breast cancer. That's another myth. More than 85, about 85% of women and men who have breast cancer actually have no family history of breast cancer in their family. And so
Mm.
that is also a myth. Anyone can have it regardless of genetic family history or not. Some people also say that you get breast cancer if you eat a lot of sugar, and that
Really?
is yes. And I think that that comes from when people say that obesity is actually a risk factor for breast cancer, but it's
Ah,
not the sugar that you eat. Really, we know that consumption of unhealthy meals of sugar, I mean, it's about we know that it's bad in it's not a healthy source of food.
mm,
Any form of refined sugar, we know it's not healthy. However, it's not directly linked to breast cancer.
Mm.
What is linked to breast cancer is obesity. And why is obesity linked to breast cancer? Because when a woman attains menopause and then they begin to add weight,
Mm.
we know that during menopause there is cessation of production of estrogen
Yeah.
by the ovaries. Now, when there is cessation of estrogen by the ovaries, the fat tissues, which we call the adipose tissues, are the ones that now stimulate the little estrogen that is available for the body. And also when you begin to add on a lot of weight, adipose tissue
Mm.
after menopause, then there is more release of estrogen than is needed, and that can predispose. It's a risk factor. It doesn't cause it. It's a risk factor,
Okay.
for breast cancer.
Mm.
okay. When we talk about risk factors as well, is there a particular age range in terms of who are more susceptible to actually getting breast cancer, and those who you can say, okay, we're still in the safe zone, as it were.
Yeah, thank you. So we have various risk factors for breast cancer rather, but the most significant of the risk factors are age and sex.
Okay.
Sex mean the female gender. We said
Mm.
up to 1% of breast cancers are found in males, and so in females, up to 99% of breast cancers are found in females. So the number one risk factor, which is a non-modifiable risk factor, that means that you can do anything to change, like genetically, your gender.
Mm-hmm.
So being female is a risk for breast cancer. And the second is age, as you mentioned.
Mm.
Now, increasing age, there's an increased susceptibility or risk factor associated with breast cancer. So we say women below 30 are less likely to have breast cancer in comparison to women 30 years
Mm.
and above.
Mm.
Having said that, We also know that there are children and young persons who have developed breast cancer.
Hmm.
In fact, there is one that is on YouTube. You would see a child that was diagnosed with breast cancer at age 9. However, there are also some other risk factors in that for people who are more likely to develop breast cancer earlier on in their year.
Mhm.
So one of the risk factors that are non-modifiable are the genetic or the family history.
Okay.
So if one has a daughter or a mother or a sister
Mhm.
who has had breast cancer, we call that first degree relatives.
Okay.
They are more likely, to be susceptible to breast cancer. They have a 15% chance. It's not a hundred, it's a 15% chance that they may then go on to have breast cancer. So it's always advised that if you have a high family history,
Mm.
a positive family history of breast cancer in the family,
Mhm.
Hmm.
then you should start what do we call it now? We should start looking for means of screening. Yes, that's what I was looking for. Screening for breast cancer from as early as 30 years.
Okay.
Ideally, medically, they say that so if you have a sister or an aunt, for instance, who developed breast cancer at 43,
Mhm.
or who breast cancer was detected in them at 43, then by 10 years before you get to that age, so if you are 33 and your sister got breast cancer at 43, or your mother, then by age 33 you should start the annual screening process, and we will be
Mm.
talking about the screening processes later. So in a nutshell, the older you are, the more susceptible to breast cancer one is. So
Mm.
I hope that answers that question.
Yes, it does. Yes, it does. That actually is very, very interesting. And just still staying with that. So how important is it for women who, okay, well, women generally, I mean, for some women who might not be aware of some of the medical histories that maybe their parents had or relatives had, how key is it for these women to do, should I say, some digging into medical histories of family members, or maybe their mom? I mean, for their mothers it's actually easy, they have direct access to their moms and all that.
Mhm.
But how about maybe to some aunts and other relatives who might have had those might have been exposed or might have had breast cancer at some point? How important is it for them to do that digging medically to find out, oh, auntie, this, so did she have this, or do we have history of this in our family, and so on and so forth?
Oh, it's really important because when you know, then you can do better for yourself by ensuring, like we talked about, early screening. So you
Mhm.
know that. So ideally, it is recommended that from age 40, you have annual mammograms done. All right.
Okay.
Okay.
Well, so it depends. WHO says from 45. It depends on the settings and the affordability, and that's based on the affordability of some of these tests, like for a mammogram. So from age 40, it really is advised that you start to do a mammogram yearly.
Okay.
It's an X-ray of the breast, and
Mm.
it helps to detect very early signs, of breast cancer. Having said that, so it takes me to the screening part, the things that you should do to prevent breast cancer.
Okay.
There is something called self breast examination. All
Mhm.
right. Self breast examination is something that you do, and it's really an easy method in which you can catch, you just detect breast cancer.
Mm.
One of the commonest signs, or the most common sign for breast cancer detection, early detection, is lumps, finding lumps in the breast.
Mhm.
And so when you do a self breast examination
Mm.
monthly, you necessarily don't have to do it every month, but for consistency and to remind yourself as something that you should do, we recommend that you do it every month, examining your breast, and it takes less than 10 minutes to do, and it's so I brought out a model. If I mean, for those joining us on YouTube, they may be lucky to see how, to do a self breast examination. So that is one thing that you must do every month. Another thing to do is a clinical breast examination.
Okay.
A clinical breast examination is you going to the hospital and telling your doctor, please examine my breasts. They are saying, we always say that you should always have an annual check and yearly check,
Yes.
of your blood pressure, of your blood sugar, of your cholesterol. Once you hit that age 30, before we'd say 40, but now because we see a lot of medical illnesses in younger people, hypertension, diabetes, we say start earlier. So it should be one of the routine checks that you do, or you ask your physician or your health provider to do for you when you go in for whatever it is. Go in and have them do a clinical breast examination for you, and then we then go on to the mammogram and to the other things, the other tests that can be done.
All right.
Right.
We'll talk a lot more about mammogram and other tests that can be done, but we need to go on a quick breather right now, and on the other side we'll continue the conversation. Stick around, Lagos. This is Smooth Health right here on Smooth 98.1.
Is smooth health on the drive. This is smooth health
So
on the drive.
people say sugar.
Can I talk?
Yes, you can.
Okay. So how am I doing?
Great.
Fantastic. People say sugar can cause breast cancer. I've never heard that before.
Oh, it's one of the things that people say causes.
That's
It's
a
just the way people
misconception,
say.
actually.
That sugar is indicated in a lot of things.
Sugar is in everything.
There are there are a lot more meats, but I can go on and on and on.
So many. Okay, so with checks, I was gonna ask, anyways, probably when we get back in, but that so I know that some doctors will say that you check after your period for a woman who's
Yeah.
who is still undergoing her
Menstrual
regular
period. Yes.
cycle.
Yeah.
After her period, she just checks.
Mm.
However, I know that there are some times when this is from a personal experience.
Experience. Yeah.
I could just feel, and it's not like it's a lump, because some people don't even know when it's a lump and when it's not a lump. So how do you get to?
So then that is in the technique,
Okay,
and I'll teach you before we leave.
great.
That's in the technique of how you examine.
So it is one of the things that I'm sure Lagos will definitely want to catch up on and figure out how to do the checks.
So we will talk about the symptoms because that's
Yeah.
really important.
That's the next
That's
thing
the-
I'm actually going to ask now.
This is smooth health on the drive.
Happens. All right, Lagos, welcome back. This is the second half of Smooth Health right here on Smooth 98.1 Smooth Drive with Ayo and Joy. And we're having such a wonderful discussion this evening talking about breast cancer. Hey, it is Breast Cancer Awareness Month, and it's very important that we put the spotlight on that. And, having this conversation with us this afternoon or this evening is Dr. Anne Olowu. And she's been breaking it all down for us. And of course, she actually has shared some myths about what breast cancer isn't and all that. But we need to talk about the signs and symptoms. And for all our listeners out there, once again, you can be a part of the conversation by sending your messages in via WhatsApp on 0809 440 981 0809 440 981. You can also join us on the live stream on YouTube at Smooth 981 FM Lagos. So for all our listeners, can you just detail those early signs and symptoms of breast cancer that everyone needs to be vigilant about?
Yeah, thank you. So the most prominent or the most frequent sign that a lot of women present with is a lump in the breast. Now, it's not only a lump in the breast. The lump can also be in the chest wall, and the armpits. Those are three places where you can have lumps. And why are those places indicated, the chest wall and the armpits? Because the lymph nodes that drain the breast, we have them along the chest wall and the armpit.
Okay.
And that's why when we teach people to examine their breasts, we also teach them to examine their armpits, because the lymph nodes there are significant, because if there's something wrong with the breast, the lymph nodes will be inflamed, it may be inflamed as well. So
Okay.
having said that, we must also note that some people with breast cancer don't present with a lump. And that's why it's important that we do the radiography examinations, i.e., mammogram,
Mammogram. Mm.
ultrasounds, and the rest of them. So, which would be indicated by the physician. So, lump, we've established lump. Then we have something else. We have some other symptoms around the skin or the shape of the breast. First, there may be distortion of the breast, because if there is a lump there, the shape and the contour of the breast may change.
Mm.
So that's another. And then we have the skin changes around the breast of the
Okay.
affected breast.
Okay.
There may be discoloration. It could be darkened. It could be purplish. It could be pinkish, depending on your skin color.
Mm.
Okay.
There could also be thickening of the skin. So there's a change in the skin, the skin feel
Surface.
and the look, and yes, the skin surface. So there may be puckering and dimpling, something we call peau d'orange look. That is, if you were to take an orange, there's this dimpling on the
On-
puckering, yes,
Right.
on the
right.
surface of the orange. So
Yeah.
we have some women having that change on the skin. It's showing that there's something going on there. We could
Okay.
also have swelling. Right. We could have pain, though pain is not a significant, is not a usual symptom for breast cancer. So if there is pain, sometimes it's an indication of something else and not related to breast cancer. However, if the pain comes on gradually and then it's persistent and it becomes intense, it may be an indication of breast cancer.
Okay.
Another thing is a distortion of the nipple. So the nipple that wasn't inverted before can then become inverted, or it just may change.
What does that mean for people to be inverted?
So normally some women have inverted nipples, which is their normal breast morphology. For most of us, it's everted, it's out.
Okay.
Yeah.
Okay. Okay.
But for some women with breast cancer, some of the signs, it's in it, and then it goes,
goes
in,
in.
because it's dragged in. So it's like the tumor is dragging
Ah.
it in. So that's another symptom. Can also be discharge from the nipples. It can be bloody discharge, it can be watery discharge, it can be foul smelling discharge.
Okay.
And then lastly, another symptom or sign, rather another sign that you see, may be sores around the skin of the breast.
Okay.
So those are the common signs and symptoms that you see with breast cancer.
That's really interesting, especially considering when people talk about it with regards to the inverted nipples. Some people who naturally have inverted nipples will think, oh, okay, so maybe that's another sign for me to quickly run to the hospital. But at least now you're
Yes,
dispelling
it's a
that
change.
it's
Yes.
has to be like a serious change for you before you
Mhm.
have to go to the hospital.
Yeah.
So, uh, how important actually is it to find out what the prognosis and treatment for someone who's actually being diagnosed with cancer, breast cancer?
Oh, it's very important because, and that takes us to the staging of breast cancer, that and the different types of breast cancer. There are different types, and some of them are more invasive than others,
Okay.
and some of them are they're easier to treat than others. All right.
Hmm.
And so they're also, and then depending on the staging, so there are different staging for breast cancer, but I would mention the TNM staging. TNM
Okay.
staging, T stands for the tumor size,
Okay.
N stands for lymph node involvement, and stands for metastasis. So for the tumor size, the smaller, so the tumor size can be from T1 to T4. So 4 being the biggest size.
Okay.
Yeah. So from what so that's that for the tumor size. Then for the lymph node involvement, there's the lymph node involvement, the rating is from 0 to 3.
Mm.
3 means, I mean, 0 means no
No.
lymph node involvement. And we remember we talked about the lymph nodes that they drain. You find some of them on the chest wall, you find some of them
The
in
armpits.
the armpit, some of them the supraclavicular, that space between the the clavicle. So we have those lymph nodes there. So depending on the affectation of the lymph nodes,
Okay.
it will determine what stage 0, 2, 3. Then M is metastasis. That's 0, M0, and M1. 0 means no metastasis. That means that the cancer has not infiltrated other cells outside the
Oh, okay.
breast. And usually for metastasis from breast cancer, the sites that are usually affected, that can be affected, where metastasis can proceed to, are the brain, the bones, the lungs, and the liver. So 0 means no metastasis outside the breast.
Okay.
It's confined to the breast. M1 means it has metastasized. It has gone beyond the breast. It can be to the bone, to the brain, to the lungs, or to the liver. So depending on the person's staging, so the earlier stages are easier to manage compared to when there is metastasis here. So when there's metastasis, that's a lot more, and that affects the chances of survival. And that's why we are here talking about early detection, because what you would need to take care of a stage 1, or a stage 2 breast cancer, or even a stage 3, it's not what you need for a stage 4. And then if I may go to the different management, so it will determine which of all of the management of breast cancer that person will have. But the important thing to know is, and to remember, is that the earlier the better. And as soon as you find that there is something, if you're not sure, just go to the hospital, have it investigated, and don't stay and you just keep watching. No, if once you're unsure, you see something that bothers you, have it checked out, because the sooner better than
Later.
than later.
Okay, let me take a quick message here on WhatsApp. It's a question from Wally who says, do birth control pills predispose women to cancer?
That's a good question. And so it's research has shown that people who take combined contraceptive pills have a risk. It's a risk factor. Not that it causes, it's a risk factor. We talked about the hormones, yes, the presence of the hormones in the body. So both for oral contraceptives and for IUCDs, that's intrauterine devices,
Right.
with hormones in it, hormonal contraceptives, and also for postmenopausal women who need to have hormonal therapy. Right. There is a factor in the fact that it can be a risk factor. So the different researchers have debunked it, so it's a bit controversial. But what to know is, if you can avoid it, look for other methods. However, it's also been said that the risk of the risk that is associated with use of oral contraceptives in relation to breast cancer, it goes off as soon, not too long after you stop taking the contraceptives anyway. So the risk, yes,
Naturally.
dies with not use after a while.
Okay, I hope that actually answers the question. Man, time has absolutely flown by. So, Dr. Olowu, let me just ask this really quickly, because what resources and support networks are actually available for individuals who are diagnosed with breast cancer and for their loved ones as well?
Resources. Before I talk about resources, let me quickly talk about what they need. What people who have come down with, who have the diagnosis of breast cancer, what they need, and I'll say it in four different levels. First, good health care, because it's not enough to detect. What are you doing? What intervention? So ensuring that you have the best health care. So it's a family, so it's something that everyone has to come together to do their research. What's the best health care that I can get? We know we have federal hospitals, we have state hospitals, we have private hospitals. You need to bring everything out, because for management of breast cancer, it's a team effort. You need the surgeons, you need the radiologists, the oncologists, you may need other caregivers, you need nurses certainly. So it's a team effort. So that's that for healthcare. Financial, there is need for financial resource. So
Not a small
it's
thing
not
at
small.
all.
It is not small. If you want to get the best care, you have to spend money. Money is involved, and so um, anyone who has been someone who has been diagnosed with breast cancer will need all the financial support they can get. And then talking psychosocial support, it's important that that person knows that they are loved, they are valued, they so that they can have um, the best, what's it called now, the right mind, mental health
Mindset.
and
Yeah.
mindset to be able to to fight and to go through all the rigors of therapy. And then the fourth thing is spiritual health, spiritual care, because research has shown that people or patients who have strong spiritual and psychosocial support actually do better. So in that sense, what they need are in all of those four things. Now, talking support for patients. So usually in the hospitals we have, depending on the hospitals, there are support groups. There are people everywhere, even in churches, in religious organizations, in social settings. We have people living with breast cancer who have survived breast cancer. So one, if you have that diagnosis, you can find them. They're everywhere. They're on social media, locally, the hospitals, religious spaces, socially, everywhere. You can find help and resource.
All right, fantastic. That has been very eye-opening. Let me round up with a message here. This is from Cappuccino, who says, "Thank you, Dr. Anne. I learned something today about breast cancer. Fantastic. It's great to know that you've learned something from this, and we can have this conversation for hours and hours.
Yes.
There's just so much to talk about.
So much more to
Yes,
actually
but
delve into.
time actually isn't on our side. We'll have to, round up the conversation right here. But for all our listeners out there, you need to go on the live stream right there on YouTube, because Dr. Olowu is going to do a demonstration of how to do an actual breast examination. So that's just to give you a visual of what it is that you need to do and what you need to understand as well. Thank you so much, Dr. Anne Olowu, for being here with us to talk about this very important issue. It's been a pleasure speaking with you.
Same here. Thank you for having me.
All right, Lagos, the Smooth Drive will continue right here on Smooth 98.1. Don't go anywhere. Stay with us.
Thank you.
So we'll do the demonstration while we're still live. So at the end of the day, anyone who goes live will be able to see it.
See what it is on how to. So yeah, you can bring it up so we can.
Okay, so Lagos, this is the demonstration of how to properly
Examine the breasts.
and it's for both men and women. So
Yes.
So don't make it sound like it's only.
Yes,
It's not only women; it's only men as well.
yes.
So, very
Men need
important.
to know how to examine, not just for themselves, but for their loved ones. We have mothers, we have daughters, we have wives, we have sisters. Sometimes it's the men that have actually discovered the lump in their wife's breast. I kid you not. Yes. So it's important that men also know how. Let me get the gloves so that if you want to, I have gloves on.
Interesting.
So in case you want to help someone.
No, I would like for you to examine as well. So you could,
Okay.
yeah, wear gloves.
We're going to be doctors. Doctors help us.
For a couple of minutes.
So we said that when we're examined, so there are different ways. It's always good to start by looking. So we say three things: you look, you
Okay.
touch, and then you feel, or you squeeze, whichever one. So, but it's important to look. So people, and the breast can be examined while lying down, while standing. So people can do it while they're having their baths. They can do it while they're lying down. They can do it sitting down.
Okay.
What is important is to ensure that you use the flat of your fingertips and not like that. You don't poke.
You don't
Don't
poke.
poke, yes. And so what you were talking about sometimes feeling something that's like a lump.
Yes.
Yes. We have lobules.
Yes.
So that's what you're feeling. That's hard. And that's why you need to do it flat. You see, it has to be, you have to do it flat. So it's a pressing thing. It's not a poking
Not
thing.
poking.
And once you poke, you'd feel
Naturally, you feel those.
the lobos. And the reason why we say do it outside your menstrual cycle is because during the menstrual period,
They're
yes,
puffed up. And
yes, they're puffed
more,
up and they are tender. They can
Yes.
be painful. And so we say don't do it around that, because then you may think that you are feeling something. It's also with breastfeeding mothers as well. So it's hard for them to know what it is. So there are three. And remember, we said that we'll also check the armpit and
Yeah.
the chest wall. So before we start,
Mhm.
so there are three ways to check your breast. You can go the circular motion, start from outside, and I'll teach us how we go inside, or start from inside and then you go out.
Okay.
Then you can go down
Okay.
vertically, and then you could go diagonally, go this way, come this way, go. That one can be cumbersome if you're not used to it.
checking.
Yeah, so I would always recommend go vertically or go in the circular
circular.
motion. And don't forget, we said we will not use the tip, we'll use the flat palms of our
fingers.
Yes, just like that, because that way then you're able to.
To actually feel.
So for women who have bigger boobs, they may feel, oh, I'm not doing it well. All you need to do is just raise the breast and press down. Because I've seen that as, yes, some women are just like, oh no, just lift it up and press down, and then you're able to. So let's start. I'm going to take the vertical motion now for ease. And so you go from one end to the other. So this is the chest wall. So I'm going down, starting from one side. I can start from the middle. The point is I'm going flat.
Okay.
If there is something, you would feel it. You'd see, demonstrate that. It's really easy. It's something that you will do in less than 5 minutes. I say 10 minutes, but that's an exaggeration, really, because you get it done once you're used to it. So, and you just need to press down. Once you press down, if there's anything, you feel.
You feel. Okay. So. Okay. See what you mean now. Okay. Okay. So now I can actually feel that there's something up here.
Yes.
It feels different.
Yes, actually feels different.
You would know.
Yes.
Once you're doing it properly.
Once you get the hang of it. So all here, because I'm actually just doing this, there's no lump. But the minute I start to feel it, I feel that there's a lump.
So keep on doing it and see. Do it properly.
Okay.
That's it. What you're doing is it.
Do you want to try?
Yeah.
I'd also
Okay.
help you.
See.
You'd like to try, right?
Okay.
Now you understand what it is.
Okay. Now, okay. So that's what a lump feels like. Okay.
Yes, sir.
There are different types of lump. There are actually more than one. So keep feeling.
Okay. I can feel there's clearly something going on here. Something going on here. Definitely.
Yeah.
Doesn't feel as I can't really feel anything on this side.
So obviously. So go in. Go further in.
There's an obvious difference.
Yes, there's that is an
Obvious
obvious
difference.
lump. So
Yeah.
this is a type of lump, right? Now there is another lump. This is a different type of lump. So you missed it. So because you missed a spot. So maybe if we had done circular, you wouldn't have missed it. Can you feel? So there are different types of lumps. They are different. Not one lump is the same.
It's
thing.
not one.
Yes,
thing,
because the lump, the tumors are different. There are some that are benign tumors. Some are benign tumors. That means that they will not become malignant. They will not become cancers.
Okay.
So most of them are like this one that you felt.
Oh,
But
okay.
this one, because
Is it at
it's
that point?
discrete, so it can easily be removed. That's what they use usually, lumpectomy.
Yes, that's when we suggest for that to be
yeah.
removed.
So there are different types. So that's why it's important to do it properly.
Okay.
But now you have an idea.
Yes.
And it won't be like when you say, oh yeah, examine your breast. It won't be something up in there.
Strange.
Yeah, because you understand
what
would be if there were an abnormality.
Okay.
Yeah.
Fantastic.
Great
All
session.
right, I hope we've learned something.
You should have
And,
had 10. You have had 10 together. Okay.
All right, Lagos.
thank you all for joining us. Have a great one.